Hello, my name is David and I'm going to be showing you guys how to obtain a nose, throat, and culture specimen collection on a patient with a suspected upper respiratory infection or sinus infection. This procedure is a clean procedure. We would want to obtain these cultures before the patient starts any antibiotic therapy so it does not skew the results of the diagnostics, or if they have started antibiotic therapy, we would want to inform the lab of that as well. So we want to perform this procedure 1 hour before the patient has had anything to eat or drink, or 1 hour after they have already had their meal and their drink to prevent vomiting or the gag reflex. Before we begin the procedure, we're going to explain to the patient what's going to go on during the procedure. So we're going to have the patient sit in a high phallus position. They're going to be tilting their head back, and I'm going to use my tongue depressor to hold the patient's tongue down and my pen light to assess the pharynx and the tonsillar area for any purulent drainage, any signs of inflammation or tenderness. I would inform the patient that they may feel a bit of discomfort or a bit of a gag reflex while I'm swabbing the tonsils. So the materials that we're going to need for this procedure are going to be some clean gloves, a biohazard bag, our specimen culture tubes. These need to be sterile, as well as the swabs that we're going to use. We have a pen light, a tongue depressor, and some facial tissue or gauze for the patient. First thing we're going to do is we're going to wash our hands and put on our clean gloves. Go ahead and give the patient some tissue or gauze just in case they need that. We're gonna loosen our swab and culture tube just for easy access. We're gonna take our tongue depressor, put it on the anterior part of the tongue. We're going to assess the pharynx and the tonsils for any inflammation, any purulent drainage. Just going to document what we see. Alrighty, now that we've done that, we can go ahead and get ready to swab. Alrighty, so we're going to take out our swab, put our tongue depressor on the tongue, ask the patient to say "ah" and tilt their head back. And we're going to swab the area of the tonsils. We're going to do this quickly and gently. We're also going to be sure not to hit any oral structures that may contaminate our specimen. I'm going to go ahead and place that in our culture tube. We're going to document this with the patient's name, the patient's ID number, the time and date of the specimen collected, and we're going to send this off to the lab for diagnostics. We would also place this in our biohazard bag. Okay, so now I'm going to perform a nasal specimen collection. I've already washed my hands. I'm going to go ahead and put on my gloves. So I'm going to explain to the patient why I'm performing this. This is indicated for a suspected sinus infection. I'm going to go ahead and take a look inside of the nostrils for any redness, inflammation, any signs of infection. Okay. So I'm going to explain to the patient that throughout the procedure they may feel a bit of discomfort or the urge to sneeze while I'm swabbing the nostrils. I'm going to go ahead and ask the patient to tilt their head back for me. I'm going to take my wire swab out of my specimen collection. I'm going to swab the nostrils, making sure not to contaminate as I exit. I'm going to go ahead and place this back into my specimen culture tube. I'm going to take some gauze here and crack the end of the tube to activate the liquid at the bottom. I would date this tube with the patient's name, the patient's ID number, and the date and time of the specimen collection. Go ahead and place this in my biohazard bag for the lab. If the patient does have a upper respiratory infection or sinus infection, you may see elevated white blood cells. Some expected outcomes of this procedure would be to educate the patient properly on why the procedure is being performed. You want to perform the procedure without any trauma to the tonsillar or pharynx area, and you would like to see the absence of bacteria on the culture. Appropriate caring behaviors performed by the nurse during this procedure would to be correctly positioning the patient, instructing them and guiding them through the procedure, and being very gentle while obtaining the culture. So one of the nurse's responsibility would be relaying to the patient the results of the procedure, determining whether or not they are infected or if they are. If they are infected, we would explain to the patient any antibiotic therapy that would be ordered by the physician or any treatment that would be ordered moving forward.
Presently, I'll be showing you how to obtain a culture specimen from a wound. This is a sterile technique that cannot be delegated to a nursing assistant. So first we'll need to explain the procedure to the patient and assess their ability to cooperate with the procedure. We're going to be assessing for any signs of fever, chills, check the labs for an elevated white blood cell count. We're going to be asking the patient any pain that they may be in. Around the wound site, we may need to administer pain medication 30 minutes prior to reduce some of that discomfort during the procedure. Okay, we'll go ahead and review the healthcare's orders for an anaerobic or a aerobic culture sampling, and we will gather our materials. Okay, so some of our materials that we're going to need today are going to be a wound kit to redress the wound after we remove the old dressings, a biohazard bag to put our specimen culture in, and we'll also need 2 culture tubes with a swab and a transport medium, and we will need our swabs sterile, and we'll need sterile gloves because this is a sterile procedure. Okay, so some patient education that we're going to provide before we get started is to let the patient know that they may feel some pain or discomfort around the site that we're taking the culture from. They may feel a tingling sensation. Okay, so we've already removed the bandages from the wound. It has been cleaned with an antiseptic swab, and now we'll go ahead and begin to take our sample. Okay, for an aerobic culture, we have put on our sterile gloves, and now we're going to go ahead and take the culture. So we will go ahead and gently rotate at the wound site and insert the swab back in and crack the bottom. And we will put this in our biohazard container, making sure that we label the patient's name, the date, the specimen from where it was obtained, and the time. Aerobic wound culture, we're going to go ahead and do about the same thing as the aerobic, but we're going to go deeper into the wound. So we'll go ahead, and we've already cleaned the wound, we've got our sterile gloves on, and we insert deep into the wound and gently rotate to gather. And we put our culture back in, and we will label this specimen as well and insert it along with our other and send it to the lab. Okay, some expected outcomes from this procedure is that the wound culture does not get contaminated, and the white blood cell count may be elevated due to a possible infection. The patient will tolerate this procedure well, and we will make sure that these specimens are sent to the lab as quickly as possible so that they are accurate.